My name is Philip Williams, orthopedic sports medicine surgeon in Houston, Texas. Just going to give out some answers to some of your sports medicine questions. I am a sports medicine surgeon here in Houston, and I focus on athletic injuries of the shoulder, hip, and knee. I'm just going to wait for folks to join before we get started. Thanks for joining. Flem22, I see you're here. Thank you for joining. Just going to wait a minute or two to get more people here so we can make this as productive as possible and I can answer your questions. And I typically do these for a few minutes when I have the time. Right now I have a few minutes before I start my afternoon clinic, so I might have to jump off after about 20 minutes or so, but I'm happy to answer any questions that you may have. And we're going to get started in a second. Thanks for joining, everybody. Peachy24, thanks for coming. Adam Kiram Ayed, thank you for coming. And we're going to get started in 1 second. Again, I'm a sports medicine physician. I do orthopedic surgery. And I focus on shoulder, hip, and knee injuries. So I'm just going to answer those questions related to that. So Flem22 says, can I still play ball after a knee replacement? So knee replacements are typically for people who have arthritis, and they are really for people who are looking for pain relief and not necessarily looking to go back to a sport specifically. There have been some studies that show that after a knee replacement, you can maintain a healthy and active lifestyle, but doing high impact activities may not be beneficial because that can lead to early wear and tear of the actual replacement. So it depends on the situation, but typically doing high impact activities like playing basketball or other sports may not be the best activity to do after knee replacement. So we're going next to Addison. Why is my knee still hurting? It's been hurting for a few weeks. I can't answer that question. That's a specific question to your symptoms and your diagnosis. I would have to examine you to determine that. So Billy Trosper says, what does a hip labrum injury look like? So hip labrum injuries usually are felt in the groin of the hip, and you have pain with different activities. Sometimes you can have pain with sitting. Sometimes you get pain with squatting. Sometimes a lot of soccer players can have this injury and it hurts when they kick. And it usually is in the groin. And that is very specific for a hip injury. If you have pain on the side of your leg or somewhere else, it typically is not a labrum injury, but typically you're going to feel a hip labrum injury in your groin. Roy says, rotator cuff surgery for a 63-year-old to reattach a ligament. So rotator cuff surgery is a very common procedure that I do, and the age group really varies. Usually in their 50s is kind of the earliest, and then it ranges up from there. But if you have a full thickness rotator cuff tear, meaning your rotator cuff is not attached to the humerus, it is a very routine operation to have that fixed arthroscopically, and patients do pretty well for that. Amanda, so if I missed your question, please send me a DM. And Connor says, rolled my ankle a few weeks ago, didn't swell much, but still hurts to put pressure. Is this normal? I can't really comment on your specific injury, but ankle injuries and ankle sprains can take a while to recover from. You should perform physical therapy, working on strengthening of your ankle and working on range of motion. If it still is abnormal and still bothers you, I usually recommend patients to at least get an x-ray in that situation. So Devin says, what could be causing knee pain when I play basketball as a young athlete? A lot of young athletes, especially runners and jumpers, have jumper's knee is what we call it, or is the typical name for it. And that really is patella tendonitis. The patella is the bone, your kneecap, and the tendon right below that is the patella tendon. So a lot of jumpers can get overuse injuries where the patella tendon gets irritated and inflamed. And physical therapy working on strengthening your hamstrings and stretching your quads is the typical treatment for that. So I'm going to skip around. If I miss your question, please send me a DM. So KB says, MMA fighter here. I had surgery because my elbow couldn't fully extend. Hurt still after surgery. So elbow surgery can be pretty difficult to recover from because of the stiffness that usually happens after elbow surgery. And if you had stiffness before surgery, it's really hard to regain the elbow range of motion afterwards unless you do significant physical therapy. So a user said, how do you heal a sore rotator cuff? So rotator cuff injuries and rotator cuff tendonitis can be improved with physical therapy, and physical therapy usually helps to strengthen the muscles around the rotator cuff and can help your pain get under control. Sometimes anti-inflammatories can help with sore rotator cuff tendons in general. So Miller 142 says, will the meds that are used on pro athletes be available for everyday people? They recover too fast. So I'm going to say it is not because of medicine or any kind of specific medication that pro athletes recover quickly. It's a factor of multiple things. First of all, they're professional athletes. These are individuals who already have a good genetic makeup to have the best possible athletic body. And so they already have at baseline a physique that lends itself to improving themselves. And the availability of other technologies is what I think actually helps them. So technologies such as they have a lot of physical therapists at their disposal, athletic trainers, and they have other recovery apparatus. So they have these, they have percussion devices, they have pools, they have anything you can imagine to help your recovery process. So I don't think it's necessarily anything they take. It's just a matter of, one, their genetic makeup, and two, the actual equipment that they have and the staff as well as a diet. So they can have a nutritionist as well to help their recovery process along. So it's a whole host of things that help these professional athletes recover. So I'm going to skip around again. If I miss your question, please send me a DM. So a guy named Courtney says, I have a long-standing patella tendon issue. Surgeon wants to do an ipsilateral hamstring autograft. Thoughts? Can't really tell you exactly what's happening from that little description that you gave me. If you're referring to ACL reconstruction, you can use a hamstring from you or from a donor, or you can use other areas of your body to reconstruct the ACL. If you have long-standing patella tendonitis, sometimes the ACL graft can still be taken from the patella tendon in that situation. And so again, I can't give you a specific answer to your question based on the small amount of detail you gave me. So P Hall says, do you like CPMs for use post-op after total knee replacements and rotator cuff tears? So CPM stands for a continuous passive motion device. And that helps to move a joint after specific surgeries. And it used to be used very routinely for a lot of these procedures, but we found that the active motion of the patient actually doing the motion of the joint actually is better and more beneficial. So the short answer is I do not use a machine to move the joint after a total knee replacement or a rotator cuff tear, especially after a rotator cuff tear. You don't want motion necessarily after rotator cuff repair surgery. So Zoe asked, what was your path for becoming a doctor? What did you study while being pre-med? So I actually had a very unusual path. I was a political science major in college, and I was not pre-med in college. So I went to work after I graduated college and realized I wanted to become a doctor. So I had to go back and take my pre-med courses. I did a post-bac pre-med program, and eventually went to medical school after that. So it's not a typical course that I followed. I actually have a course online that I have that can show people how to do the non-traditional medicine course. If you're interested, send me a DM. I can send you information about that course. So TS, what about a locked shoulder after rotator cuff surgery? So it sounds like you are referring to stiffness after rotator cuff surgery. That is very common after rotator cuff surgery, because after rotator cuff surgery, you have to be immobilized for a period of about 6 weeks, and that can stiffen up your shoulder, but that is usually improved with physical therapy. So question on LinkedIn. In practice, I observe that so Dr. Dennis Shavelson says, in practice, I observe that a collapsed foot internally rotates the leg and knee, increasing the medial knee moment that produces medial knee pain and bone-on-bone x-rays. Do you advise treating the foot in those cases? So that's an excellent question. So the question is basically referring to the alignment of the foot, and it has been shown that having poor alignment of the foot, especially if your foot kind of internally rotates, it puts more pressure on the inside part of the knee. And if someone has obvious changes in their foot, when I see them, I usually do recommend having their foot addressed with some kind of orthotic or some kind of treatment to the foot, and that may sometimes help their knee pain. So excellent question. Thanks, Dr. Dennis Shavelson. So George Munoz, I just missed your question, sorry. So Gregorio Munoz says, what is the success rate for lateral meniscus transplant surgery? So that's an excellent question. Lateral meniscus transplant surgery, or any meniscus transplant surgery, is necessary for someone who's had usually multiple knee surgeries looking at their meniscus that has torn, and the success rate varies depending on how bad and how significant the joint space is. So sometimes the joint space narrows after multiple procedures to the knee and multiple meniscus surgeries. And in that situation, the success rate can lower. I would put it probably at about 80% in terms of the success rate for meniscus surgery, as long as the correct technique is followed. Vishkar says, I look like Rajon Rondo. Yes, I used to be confused for Rajon Rondo when I went to medical school at Harvard in Boston, because he was playing on the Boston Celtics at the same time. So people used to stop me on the street and call me Rajon Rondo. I used to, I would sometimes correct them. So Jake says, I tore my labrum in each shoulder and I had surgery, 11 anchors in each. How do I prevent arthritis? So unfortunately, I'm going to say that arthritis cannot necessarily be prevented by having surgery. The problem is the actual injury. So when you have an unstable shoulder, which it sounded like you did, the problem is that the shoulder joint is not moving normally, and that is what causes the arthritis over time. But as long as you get appropriate surgery to fix and stabilize your shoulder, that gives you the best chance of having a normal shoulder without arthritis in the future. So Josh said, I tore my ACL and ruptured my meniscus. Doing hamstring strengthening work hurts. Why? Depends on where the graft is from. So if you tore your ACL and ruptured your meniscus, hamstring strengthening is actually beneficial. Is beneficial because it helps to stabilize the knee. And most likely what's happening is that the leg in general is weak, because after these specific surgeries, you're going to have weakening and atrophy of the leg muscles, and that's going to cause more problems and pain in general. But you have to push through it to a certain extent, is what I tell my patients, in order to get that strengthening, because the knee needs to be stronger to prevent any future injury. So I'm going to keep going, and if I miss your question, please send me a DM or something. So So RJ says, what should I do? I think I tore my rotator cuff playing baseball. Any treatment ideas? And so I would say this. First, you should get evaluated by a orthopedic surgeon, because many patients in general, you don't really know what your injury is. You can really guess and think that you tore something, you tore this, tore that, but unless you get an evaluation by an orthopedic surgeon with x-rays at least, that should be the first step in deciding what your actual injury is. So you can always think that you have something, but it may not be what you think it is. So that would be my first suggestion there. So Bree P. said, college volleyball player, tore my PCL 2 years ago and still experiencing pain without surgery. So the PCL is a posterior cruciate ligament that helps the shin or the tibia from subluxing or going backwards on the knee. And if you have an isolated PCL tear, sometimes we treat that non-operatively, so without surgery and just physical therapy. But if patients continue to have pain and somewhat instability symptoms, I usually recommend a surgery in that situation. And so if someone comes to me with pain for years after a PCL tear, I've seen that type of patient, and I've done surgery to fix that PCL if it's still a problem. So I'm just skip around here. Again, if I missed your question, send me a DM. So AC says, how long would you be out for baseball after a torn rotator cuff? Depends. If you had surgery for a torn rotator cuff, it takes at least 4 months usually to recover enough to play a sport at a high level. Marion Rollins, 16, said, I tore my ACL in 2007, tweaked it again a year ago. Should I still wear a knee brace when playing sports? So if someone comes to me in that situation with those symptoms, I don't know what a tweak means. So you have to define what tweak means. And tweak can mean you just had a mild pain and it went away, or tweak can mean you have instability symptoms. If your pain is still bothering you, I'll definitely see a orthopedic surgeon to evaluate it. And my standpoint in general with knee braces after an ACL tear, I don't necessarily recommend a knee brace because it hasn't been shown to prevent future ACL tears. What a knee brace does in many cases is to give athletes the sensation that they feel better. So it is more treating their head than anything. And if you feel like you feel more stable with a knee brace, I would recommend doing that just to give you peace of mind, because that's most likely what it's doing more so than anything else. Colton says, how long do you think recovery should be for an MPFL reconstruction? In general, MPFL reconstruction for patella instability takes about 4 to 6 months. And that's about 6 months if you're going back to a high level sport. This is a question on Instagram. Big Moose says, I've had patella tendonitis for a while now. What are some treatments for this, operative and non-operative? So patella tendonitis, again, is a overuse injury. And basically the way you treat overuse injuries in general is to rest, first of all. So rest, take time off from your sport. And the next step to that is physical therapy. So stretching your hamstring specifically and working on strengthening your hamstring specifically and working on stretching your quadriceps. That's the best way to treat that. So I'm going to skip around. Death by Bananas 3 says, ACL is strong, but I continue to have popping and cracking in the same knee 2 years after surgery. Again, if you have cracking in your knee, cracking in the knee is not a concern for most orthopedic surgeons. If you don't have pain, the cracking can be ignored. It's an annoyance, but not a concern in the majority of the majority of cases. Richie Simprick says PRP for partial labrum tear. So PRP stands for platelet-rich plasma, and that's a solution of your own blood, where we take your own blood from a blood draw and spin it down in a centrifuge, and then it concentrates the platelets in the blood. And the platelets are actually shown to have growth factors and other healing factors that could heal injuries, but most likely, or more commonly, they heal and improve pain. And PRP for partial injuries, partial tears can have a beneficial effect. There haven't been a lot of studies that look at labrum tears in terms of if PRP actually does any improvement. I would say it does not hurt to try PRP in general for some of these cases, but there haven't been enough scientific studies that show that it makes a huge difference. So it's something to try. The downside is that there's a cost to it. It's not covered by insurance, but that's really the only downside that I see with PRP injections. So Josiah says toes are numb after leg surgery 2 years later. Sorry about that. I cannot give you a specific reason or why that happened if I don't know the actual surgery that you had. I would say numbness and nerve injury is one of the complications of surgery in general. So unfortunately, sometimes that happens. So Super Ninja 11 said, I had meniscus surgery 6 months ago, but still can't run or go downstairs. Depends on the type of meniscus surgery. If you had a mild meniscus surgery, typically I would expect your recovery to take about 3 to 4 months. If you had a meniscus repair, it depends on the severity of the repair or the invasiveness of the repair. That could take sometimes 6 months in general. So it kind of ranges in terms of your recovery, if it was just for a small repair or if it was for a big repair. So that might still be within the realm of normal, 6 months after the surgery. If you feel like it's not getting better, I would definitely return to your orthopedic surgeon to get it reevaluated. Again, if I miss your question, send me a DM. So Trippy Trey 333 says plantar fasciitis. It just happened to me. So plantar fasciitis is very painful. It usually hurts. It's worse in the morning. It's the sole of your feet, and it gets very tight, and it can be a disabling condition for a lot of people. But we treat that with physical therapy and stretching. That usually gets better over time. So another question on Instagram, is supplementing with chondroitin effective for arthritis? So chondroitin sulfate is an over-the-counter nutraceutical, you can call it. It is not proven to have any effect on arthritis specifically. The medications have been in many clinical trials, and they have been plus or minus, basically. So they haven't had any conclusive evidence that it improves arthritis, but it doesn't hurt the arthritis. So it most likely has a placebo effect. So I would say it is worth trying if you don't mind taking it, but I wouldn't necessarily say it's going to improve your arthritis. So I'm going to have to get going. I got to see some patients. So I have 2 more questions that I'm going to answer. Sorry about that. David says, should I be able to play soccer the day after a hip cortisone injection? So hip cortisone injection is for people who have usually either hip labrum tears. And you can play your sport after a labrum or hip injection. Your pain should be better, but that may wear out, or that may sort of exacerbate your pain quicker. So just be careful, I would say, in general with someone who has that issue, but you usually should be able to play afterwards. So Leah, I'm going to answer this question. This might be the last question. I had a periacetabular osteotomy and a labrum repair. Will I be able to play volleyball again? And I would say in general, someone who has that procedure, that's basically reshaping the hip because of malformed socket. And usually, as long as everything goes well with physical therapy, you should be able to play your sport in general after a procedure like that. But it takes some time because that's a big operation to the pelvis. So, so sorry, I have to end this early, but I have to go back to seeing some patients this afternoon. Just wanted to do this real quick. Again, if I miss your question, send me a DM. I'll try to get to it at some point. Thanks for joining. And I got to head out now. All right. Thanks a lot. Bye.